Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a unique show for you this evening. Tonight we are featuring part one of a special two-part series on artificial intelligence at St. Luke's University Health Network. We'll be joined by a talented panel of experts from the field. Stay tuned, this is St. Luke's Health Now.
Coming up on this episode of Health Now, an in-depth look at artificial intelligence at St. Luke's University Health Network. Stay tuned.
Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Charlie Sunday. As Director of Medical Informatics, Charlie leads initiatives in artificial intelligence and provides functional leadership and day-to-day support for the use of information technology in patient care areas. He ensures that functional requirements are met in the design, implementation, and ongoing use of artificial intelligence initiatives and clinical information technology. He holds a doctoral degree in advanced practice nursing with national board certification as an acute care, critical care nurse practitioner, and undergraduate degrees in nursing, engineering, and math sciences. He has been a member of the St. Luke's clinical community for 24 years in various clinical leadership roles. Thanks for being here, Charlie.
Absolutely. Thanks for having me.
So what is informatics and how did your background lead you to the role you're in today?
Sure. So informatics is the use of data and information systems to identify workflow enhancements or use as a information set to predict different events that may happen in the future.
So when you look at what you studied, you're looking at math, engineering, nursing, how did those things culminate into your interest in an eventual participation in informatics?
So I started out in electrical engineering. I have an electrical engineering degree and a math minor, and I was planning on going to medical school. I really wanted to design prosthetics. And at the time, long story made short, I met my wife and it wasn't possible really to go to medical school at that time. And my mom said to me, hey, why don't you look at nursing? There's a lot of opportunities where you could blend what you've already learned into medicine with the nursing field. And that's how I became a nurse, and then I went on to get my doctoral degree and my nurse practitioner degree.
Did you ever imagine that the technology that you were interested in early on would evolve to where it is today and impact medicine the way it has?
No, not in my wildest dreams, actually. I thought I was going to just be working on, some subsystems, maybe designing some prosthetics and really, helping people at the bedside. And now I get to touch many more people across many different hospitals with the technology that we're using.
It's absolutely amazing to see what technology is doing. We're going to learn a lot more about it this evening. Let's meet our second panelist, Chad Brizendine. Chad serves as the Vice President and Chief Information Officer for St. Luke's University Health Network. He joined St. Luke's in 2009 after serving as the Corporate Director for New Technology and Delivery for Christus Health in Texas. He has over 17 years of experience in healthcare information technology operations, disaster recovery, business, data management, innovation in health IT, and IT strategy and IT governance. He specializes in transformational healthcare projects, including EMRs, healthcare connectivity, data management, and business strategy. Chad has worked with over 80 EHRs and connectivity platforms across a variety of community settings and has successfully integrated data in and across the health community. Thanks for being here, Chad.
Thanks for having me.
So you're the Chief Information Officer. Tell me a little bit about that role and how did you get to this point in your career? What was your background that got you here?
Chief Information Officer is a very broad role, but the best way I can define it is it's looking at the business strategy of a company and determining how technology can play a part in solving some of the challenges as well as creating opportunities for the company by leveraging technology. How I got started in software and engineering was when I was 13 and got my first computer through my uncle who worked at Ford. And I began designing software, and I got very early age. I was in a job where I was doing software engineering, and my mom came to me very similar to Charlie, it sounds like, and said, you know what, we really have a huge need in healthcare. You should really look at some jobs around healthcare. So I got involved in the late 90s in healthcare and around the electronic medical record, and just have worked on implementing those systems, solving problems for healthcare for the last 20 years approximately. And basically the short end of my job now today as a CIO is to basically design strategy, which kind of leads us into what role does artificial intelligence have in healthcare is kind of part of the question that I wanted myself as well as our team to answer, which has led us here today.
Thank you both for giving us some background information on your expertise and training. Next, we'll begin to explore the basics of artificial intelligence and technology advancements at St. Luke's. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Interested in a medical career? Consider St. Luke's if you want to be a doctor or a nurse. Based in Bethlehem, Pennsylvania, we are the area's only 4-year medical school and the largest provider of medical residencies and fellowships, and the country's longest-running school of nursing, trained at an organization that is nationally recognized in education, patient care, and quality. See why we are ranked the nation's #1 teaching hospital. Where you train matters. The best doctors and nurses train at the best hospitals. St. Luke's University Health Network.
For me as a Chief Quality Officer, AI is phenomenal and really exciting. It's allowing us to take better care of our patients by having early alerts when patients are experiencing any kind of a deterioration in their condition, or a patient shows actual signs of deterioration. So we're able to intervene earlier, and as a result, we're seeing lower length of stay, lower mortality, lower readmissions, lower complications in our patient populations, and that's just awesome. I think what it does for our providers is it helps them feel even better about the care that they provide to patients. This is really, really exciting because the work we've done so far has had such a dramatic impact. Using the sepsis algorithm at St. Luke's, we have 25 to 30% lower mortality than expected for our population of patients. With the algorithm, it's allowing us to get those interventions in the specified time frame that they need to be given. And as a result, all of St. Luke's hospitals are performing much better than hospitals nationally, in fact, in the top decile of performance. And we can proudly say that no other hospitals in our region are even at the national average. It really is exciting when you see patients who have done much better than they would have because they've been admitted to a St. Luke's hospital where we're using this very advanced technology to help keep them safer and have better outcomes. In my role, I get to impact the care and outcomes of hundreds of thousands of patients. And it's just an extremely rewarding place to be. And I work in an organization that has a culture of innovation and teamwork and caring, and it doesn't get any better than that.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching part 1 of our program tonight. Part 2 of this series on artificial intelligence will be coming in January. Joining me tonight is a talented panel of professionals, Charlie Sunday and Chad Brizendine. We've learned about your experience. Now let's break down the basics of artificial intelligence at St. Luke's and help us understand a little bit better. All right, Charlie, what is artificial intelligence? Because we hear that term a lot in relation to something like social media telling us what we need to buy. But what is it and how does it relate to healthcare?
So artificial intelligence is really computers and computer subsystems trying to work together to simulate human thought and decision making.
Which seems futuristic and seems like something we've seen in the movies, but can you give us a better understanding of how that applies to our everyday lives and where artificial intelligence is coming into play?
When you come into your dealership with your car, your new car, many times the dealership will know that you've crossed the threshold to the dealership because the key or the sensor that is hooked to the computer systems within the car sends a message to the dealership to say, hey, Charlie Sunday's arrived with his car for his service date. So that's the computer systems processing where you are in relation to the dealership and sending a message to the dealership to let them know that you're here.
Amazing and somewhat scary all in the same time. Okay, that helps a lot. All right, Chad, so we have the ability now to get our medical records right on our phones. St. Luke's uses MyChart, which is considered an electronic medical record. Can you tell us what an electronic medical record is and how does it feed into artificial intelligence?
So the electronic medical record is basically a chart of all your clinical information, whether that's with your physician as your primary care, but it's a comprehensive view of all your medical information. It truly is from the time that you're born to the time you're deceased, and the intent behind that record is to provide care and clinical information to every single care setting as you continue to go through medicine, whether that's managing a disease and understanding your past family history, or whether that's the intent behind having a child and we need to understand what your laboratory results are, or whether you have a broken arm and you need to have medical results and information through imaging. So having the ability to have a comprehensive view of all your clinical information is what folks like Charlie and other clinicians and physicians in our organization really need to be able to better manage who you are as a patient for St. Luke's.
So Charlie, as a nurse practitioner and in the provider realm, how have electronic medical records grown and advanced to help with patient care?
So it's really a repository of patient data for us. It gives us the latest data on our patients. We're able to see their care trajectory, what other clinicians are thinking about while they're treating patients. We're also able to use that data in different subsystems, like I described, to start to predict maybe outcomes that may be happening with a patient, right? So if a patient's at risk for something, we can use that data to really project the risk of that patient in their stay in the hospital.
It's really absolutely incredible that the technology is allowing us to predict what could be going on with a patient or what could be wrong and what you need to look at. You know, Chad, Charlie mentioned algorithms earlier. Can you tell us what an algorithm is at its most core level and how is it applied to things like AI and electronic medical records?
Yeah, an algorithm at the core is basically a math equation that's used inside of the system. So the way that AI works is we gather some data depending on the type of problem we're trying to solve, and then determining what the probability of that may happen is really where the algorithm has. And so it basically tells you how precise it could be at answering that question that you've asked it, and that's where the algorithm plays into part.
Absolutely incredible. And those algorithms are then used to help with kind of predictive analytics, basically, around patient care. How is that helping patient outcomes in a very practical way, Charlie?
Yeah, so we talked a little bit about informatics, right, and the play of informatics and artificial intelligence. And informatics is really the tools that are used to supply the data to that algorithm so that that algorithm can predict what that patient's journey is going to be. Then the informatics that's associated with that journey will be used to leverage different care metrics so that the risk level for that patient can be adjusted in real time. So if we look at an algorithm that we use for sepsis, our goal is to identify sepsis early, start treatment early to change the trajectory of that patient. That informatics around that supplies the data that's pertinent to that patient's risk right to the provider or to the nurse at the time of care at the bedside.
Which really seems so incredible that we would be able to use that kind of information that a patient, you're not waiting necessarily for a patient to come up with symptoms, right? You're coming up with that. That's incredible. Correct. Fascinating information from our panelists. But we're not done yet. After the break, we'll learn more about technology and software being implemented at St. Luke's. You're watching Health Now. Stay tuned.
St. Luke's continues to make sure patients always have access to leading medical technologies, no matter where they receive their St. Luke's care. St. Luke's recently cut the ribbon on a fleet of the most advanced ultrasound technologies from GE Healthcare, raising the bar of imaging and ultrasound to a level not seen in the U.S., creating consistency in radiology, vascular, and cardiology services throughout the network. The artificial intelligence built into the technology software allows our radiologists to arrive at diagnoses earlier to promote earlier treatment and better outcomes for our patients. Plus, St. Luke's relationship with GE Healthcare means these technologies will continue to perform with the newest software upgrades for years to come.
To have the highest quality of imaging, you really have to have consistency. There's not a single institution that has done this big of a replacement and investment in patient care with ultrasound. This upgrade brings cutting-edge technology and improved imaging quality to all of our exams.
My name is Jennifer Grell. I'm the Senior Director of Clinical Informatics and Training at St. Luke's University Health Network. Artificial intelligence is used in our technology platform as a means to provide additional safety nets to our patients and the care that they receive. For example, in the Virtual Response Center, we use Epic Monitor and we use artificial intelligence to help us surveil the entire network. We study workflows and we look for where is there breakdowns in workflows, how can we enhance a workflow, how can we make our end users more efficient, and ultimately, again, back to patient outcomes. It's all looking at clinical outcomes for our patients and finding that right technology to enhance clinical care. Artificial intelligence has also allowed us to be more efficient. 2 nurses can surveil over 1,100 beds without going anywhere. And we have easy access to the clinical care team should we have to grab the attention of somebody to really take action at the bedside. We are integrated into all of the network performance improvement committees, and we touch every aspect of healthcare. It's not just specific to nursing. So understanding the operations of healthcare and clinical care is really a key component to being an informaticist. So I think it's pretty cool that such a key aspect of our nursing profession was critical in developing this role today, and I get to be part of it.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an interesting show for you tonight. We're talking about artificial intelligence at St. Luke's. In case you're just tuning in, I'm joined by 2 St. Luke's professionals, Charlie Sunday and Chad Brizendine. Thank you both for being here. In the first part of the program, we talked about your backgrounds and we learned a little bit more about AI. Now let's talk about how this impacts patient care. So Chad, I want to ask you a question. We've talked a little bit about the technology, the AI, but what about monitoring devices? Tell us a little bit more about those. Well, first of all, what is a monitoring device that would be an example for us to understand? And then how does that data get from the patient to the provider?
An easy monitoring device that I think of is like blood pressure as an example. Also pulse ox, something that you wear on your finger that takes your oxygen level, but like, you know, if you were to have your blood pressure taken, that is a monitoring device, and sometimes that may be you as a patient just pushing the button and it does it, or a provider on the other end doing it. Then that data is stored, and then that data goes into the electronic medical record for us to get process and leverage to take care of you.
When you think about something like devices that people can wear at home, so we've got, you know, Apple Watches, Whoops, Oura Rings, is that information able to be utilized by providers, and can those technologies talk to one another?
So the answer to that is yes, but this is where artificial intelligence, I think, plays a big part, because the amount of data, so when you start throwing out tons of different information to providers, it begins to be almost information overload. So how do we really consolidate that information and make it more precise so we can take a more precise part to your care? So I think I answered your question, but I think more importantly is that it's almost overwhelming if we begin to, every single device, kind of think about how that could play out in your life and how that could play out in your care. And that's really where smart IT or AI comes into play with a lot of this device monitoring.
Some of the AI works to really collate data so that the human brain can process the most important points of that data, so that it's identifying what's pertinent in that situation for that patient right now.
Yeah, it's interesting because when you talk about the human still has to interpret the data. And so the concept is, right, garbage in, garbage out. You've got to put good information in to get good information out, and there still needs to be that interpretation. When you think about different fields in medicine, Charlie, what were some of the early adopters that were using AI to really benefit patient care?
Radiology seems to be the earliest adopter and also the most aggressive at using AI in different subsystems that they use for radiology imaging. So it started out with really using the computer to collate all of the information, present the information, and then move to taking films, storing the films, comparing films, and now it's at the point where the AI is looking at the films and identifying irregularities in the films based on those algorithms we talked about.
So it really can be an assistance to the providers in that example.
Correct. It's really like radiologist's assistant. Correct.
Excellent. Chad, we all went through the global pandemic, and we know with COVID that it was very difficult in healthcare across every area of healthcare, but particularly for family members who couldn't get in to see loved ones. What role did AI play during that time, and has any of that stuck with us?
Yeah, I really think it helped in a lot of the stuff that Charlie was talking about with more of our sick patients. So the more sick you are, we have AI, and I know the team will do a better job of describing this in further details as far as the clinical care, but we want to know who the sickest patients are in our hospital, and AI helped us determine who the most sick were and to take care of those people first, because we know that better interaction clinically as quickly as possible will help us better set up a care plan and take care of those patients. So we were able to leverage a lot of the capabilities that we put in prior to COVID during the pandemic.
You know, Charlie, we know about the providers, we think about the doctors, the nurses, the technicians, but who are the people that are behind the scenes that are working on data analytics and using AI tools that maybe people out there don't know about, that are kind of the unsung heroes of the team?
So we have a huge IT department that works on the algorithms that we implement into the EMR. Most notably, our clinical informatics nurses work behind the scenes to discover the data and the clinical pathways that are important to use with these algorithms.
It's incredible to think, you know, when you go to watch a play, you see the actors on stage, but when they ask the crew to come out, right, you've got lighting, you've got sound, so many of the musicians that come out, and I think often that what happens in an IT department is very much like that in a hospital.
You know, when you look at the number of logistical issues that you have during the pandemic, not necessarily from us providing the supplies, but other distributors providing supplies, they were using AI machine learning concepts to determine like what's the likelihood of getting supplies to different locations. Now these are other suppliers that were doing this analysis, but that played a part in the whole logistics side of COVID, not just for us, but for other suppliers throughout the U.S.
It's amazing. You don't realize how interconnected everything is using AI until you start to talk about it and dig into it.
It's every part of that everybody's using every single day, but most people don't know it.
We also were using, to Chad's point, logistics and determining the logistics of COVID and where our campuses are going to be impacted the most with COVID, or where our outpatient practices or our urgent cares were going to be most impacted by looking at the testing patterns and what was the escalation in testing patterns and where was that location and where would they likely go for hospital care during the pandemic. So the logistics of healthcare is also benefiting from AI.
Yeah, I would also throw out one thing during the pandemic would be security. You know, we've had a heightened security nationally and globally from more of the security side, and if you look at healthcare has been hit by a lot of ransomware over the last, publicly this hospital's going down, they can't access their electronic information, and we've had AI helping us in multiple portions of our security, from detection to prevention to threat analysis, and those things have helped us, during the pandemic and post the pandemic, protect our, patient information.
Thank you both for such an engaging conversation. Up next, more on the future of AI. Stick with us. You're watching St. Luke's Health Now.
What do you get when two visionary organizations with similar missions for caring for patients with mental and behavioral health issues decide to come together? Well, a partnership combining 210 years of award-winning health experience that will enhance our shared commitment to our community's mental health status, broaden the educational programming and services we deliver to patients and families in need, and improve patients' access to mental and behavioral health care. It's a growing geographical footprint featuring more inpatient and outpatient services, creating the largest fully integrated network of mental and behavioral health services in eastern Pennsylvania and New Jersey. United in mission and service. We are St. Luke's Penn Foundation.
My name is Aldo Carmona. I'm the Senior Vice President for Clinical Integration and the Chairman of the Department of Anesthesia and Critical Care. Clinical integration simply is getting our resources together to create better outcomes for patients. And that can involve care redesign, that can involve new programs, that can involve technology. So artificial intelligence is allowing technology to do things that human beings can find very difficult to do. For example, look at multiple data points at the same time. During the pandemic, St. Luke's was the first hospital in the nation to get real-time vital signs integrated into our electronic health record, which is Epic. And vital signs are called vital for a reason, because they're often the first harbingers of change when patients' conditions are changing. Early treatment and effective treatment saves lives. St. Luke's is probably at the forefront of that technology, and we're really well positioned to take advantage of those changes as they happen because we have a lot of the base technology here already. And I think that's the difference that the network has in our great outcomes, is that we're able to do those things. There's a great team of people here that make that happen. That to me is the biggest reward, is to say, can we create processes and can we use technology wisely, and can we help our staff to not just take care of one patient, but to have that system go in place that just keeps improving to keep getting outcomes better long after I'm gone.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation so far about artificial intelligence at St. Luke's University Health Network, but we are just beginning to scratch the surface on this topic. I'm excited to share that part 2 of this series will air on January 16th, 2023. Make sure you tune in for more information about technology, specific uses, and how St. Luke's is leading the way in this field. Looking ahead to part 2 of this series on artificial intelligence, can you tell us a little bit about something that you found exciting, surprising, that we might want to know about what's coming with artificial intelligence?
One of the things that I really am excited about is using geolocation and some of the algorithms within the EMR to predict patients that may need to be transferred to a higher level of care or may need to be moved because of surges in different population-based health issues. If we start to look at some of our drugs that are in short supply and expensive, we can start to predict where those volumes are going to be most needed and shunt those expensive, costly medications to those areas instead of keeping them back at another hospital or another location. So really looking at, again, the logistics of healthcare and providing the best care at the right location.
So that when you need something, it's where you need it, correct, at the time you need it. Excellent. What about you, Chad? What's exciting and coming up?
I think every company everywhere has a labor shortage, right? We tend to have challenges with those, and what I'm really excited about is artificial intelligence and automation capabilities that help physicians, decrease mundane tasks, get rid of things that they don't really need to take care of. The same thing with nursing, with our nursing shortage, and other jobs that are very similar to that through technology we can make a difference by solving some of those challenges and making the jobs more fulfilling for our healthcare providers and really focus them on what they went to school for.
It's exciting to see how far we've come with AI, but it's really exciting to think about where we are going. Charlie, Chad, thanks for being here, and thanks to all of you for watching. For more information on artificial intelligence at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember it's important to focus on your health now.